Hello, everyone. My name is Brandon Beatty, student PT at Howard University, and today I will be presenting my capstone presentation titled The Effectiveness of Hip Arthroscopy in Soccer Athletes, a Comparative Analysis of Interventions. Right, so now going into a little background information. So there's a pathology known as femoral acetabular impingement, otherwise known as FAI, which is a condition that affects the hip joint that has become more prevalent among athletes since the early 2000s. This pathology deals with the abutment of the femoral head up against the acetabulum. Signs and symptoms associated with this pathology is pain located at the groin or hip that worsens with activity, stiffness, and limping once the pain becomes unbearable. Now, the purpose of this study here is to gather evidence on the return to play time for soccer players diagnosed with FAI who have undergone hip arthroscopy. All right, so now we're going to delve into the literature a little bit here. So soccer, as we know, is a beloved sport that's played by millions. According to an article by Locks et al., the injury incidents are about 5 per 1,000 hours of exposure globally for this sport. And based on that same article, 11 to 16% of these injuries are hip-related injuries, and FAI is one of the injuries that is pretty prevalent amongst those, or amongst that 11 to 16%. So going a little bit deeper into FAI, so there are 3 types of FAI. We have our cam lesion, which is an overgrowth of the femoral head. We have our pincer lesion, which is an overgrowth of the acetabulum impinging on the femoral head. And then we have a third version, which is known as a mixed morphology, which is a combination of the two. Excessive attempts to complete certain movements like flexion, internal rotation, and abduction will result in pain and degradation of the labrum. Right. So going into hip arthroscopy. So hip arthroscopy was first introduced in 1931 and didn't really become popular in the States until 1977. Now, the progression of this technique has been slower as opposed to other techniques, or as opposed to arthroscopy conducted in other joints or other regions of the body. So, for instance, the shoulder being one of those regions. So there are several components to the procedure. One is patient positioning. So the surgeon can either put the patient in supine or side lying. It's strictly up to their preference and judgment. The surgeon then assesses the available range of motion. Then a distraction force is added to the femur in order to open up the joint space. Next is portal placement. Right, so as you can see here, I have a picture of where the portals are placed. So there are 3 portals. We have our anterior portal, our anterior lateral portal, and our posterior lateral portal. So the 2 lateral portals are placed over the superior margin of the greater trochanter, and the anterior portal is located at the sagittal line, drawn distal to the anterior superior iliac spine. So what happens is there are guide wires placed through all three of these portals here. The anterior lateral portal gets replaced with a scope, while the anterior and the posterior lateral portal get replaced with graspers, which act as debridement tools. Right, next going into physical therapy for FAI. So the literature suggests that rehabilitation supervised by PT is recommended for this condition in order to restore muscle function, strength, range of motion, and improving the athlete's ability to return to their pre-injury sport. The training emphasis is usually on the global musculature around the hip, including the glutes and the core muscles. All right, so when it comes to return to play time or return to play in general, it honestly depends. So, an athlete's ability to return to play is contingent upon quantitative measures that assess strength, function, and levels of pain. And honestly, there's still a dearth amount of research to suggest a universal timeline for athletes to return to play after hip arthroscopy. So that was my reasoning for actually delving deeper into the research to find an answer to this question. All right, so my PICO questions are: what is the difference in return to play time for soccer players with FAI who have undergone hip arthroscopy combined with physical therapy versus those who have received hip arthroscopy without physical therapy? What is the difference in return to play time for soccer players with FAI who have undergone hip arthroscopy versus those who have only received for those that have only received conservative treatment? And lastly, what is the difference in return to play time for soccer players with FAI who have received hip arthroscopy versus those who have received no form of treatment? And these are my hypotheses associated with the questions. So, the first being soccer players with FAI will return to play faster if they undergo hip arthroscopy combined with physical therapy in comparison to those that have received hip arthroscopy without physical therapy. The next hypothesis is soccer players with FAI that have received conservative treatment will return to play faster than those that have received hip arthroscopy. Lastly, soccer players with FAI who have undergone hip arthroscopy will return to play faster than those that have received no form of treatment at all. Now delving into the methodology. So I completed an extensive search to determine the average return to play time for soccer players that underwent hip arthroscopy. Just making sure that each article that I found included soccer players that suffered from FAI. The research databases that I used were PubMed and Web of Sciences. The search terms that I used were hip arthroscopy, FAI, impingement, soccer, return to play, arthroscopic management, and sports. After screening, a total of 15 articles were included. Now delving into my selection criteria. So I included articles that were written in the English language, articles that mentioned soccer players undergoing hip arthroscopy for FAI, articles that mentioned return to play time, and articles that included quantifiable outcome measures. I excluded articles that were considered to be systematic reviews, articles that did not include soccer players in the examined population, and articles that did not mention soccer players with FAI. So the included studies underwent review using the appraisal tools from the Joanna Briggs Institute as well as the Center for Evidence Based Medicine. So I thoroughly analyzed the articles and scored them to address specific metrics determined by the appraisal tools used. The reason I used the appraisal tools from the Joanna Briggs Institute is because most of the articles found were case series and cohort studies. So I felt like these appraisal tools were appropriate for the situation, as well as the appraisal tool from the Center for Evidence Based Medicine. Right, and here is the appraisal tool from the Center of Evidence Based Medicine here. So, again, like I said, most of my studies found were case series. I had one that was deemed a 3A level of evidence, and I actually had one that was deemed a level 2A level of evidence. Right now, going into my article selection. So the research covered a range of study designs, with the majority consisting of 8 case series and 5 cohort studies. In addition to that, there was 1 prospective study and 1 retrospective study, and 1 controlled comparative study as well. The studies include diverse populations within the soccer community, if you will. So